Meanwhile, as Americans die because they cannot afford the medications they need, the pharmaceutical industry makes higher profits every year. You have complexity, but you have money for stock buybacks by the billions, and you guys became billionaires. That doesn't seem too complex to me. Multi-billionaires like Elon Musk, Jeff Bezos, Richard Branson are off taking joyrides on their rocket ships to outer space. They're buying $500 million super yachts. Today in our country, the two wealthiest people now own more wealth than the bottom 42% of our population, 130 million Americans. Two people, 130 million Americans. Anybody think that that is what America is supposed to be about? I don't think so. Today, millions of Americans are forced to make the unacceptable choice between feeding their families or buying the medicine they need to ease their pain or to stay alive. Seniors from Vermont to Alaska are forced to split their pills in half because they don't have enough money to fill their prescriptions. In your judgment, what does value mean to a woman who lost her husband because the family cannot afford the price, the outrageous price of a prescription drug? Is that a value that we should consider, or is that a value that we should consider?
We believe in access, Mr. Chairman. And as I said, our products, we're going to work really hard for the uninsured, that they are available for no cost.
But I'm asking your statement, you talk about value, and the value is, well, we've helped the economy and we've done all these things. True enough. But what about the value of the human lives that are lost or the suffering while companies make billions and people can't afford the price? Is that a value to be considered? In his budget, the president has proposed a 20% minimum tax on those who are worth at least $100 million. This is an important step forward, and I congratulate the president for doing that. We should go further, though. In the richest country on earth, senior citizens should not have teeth rotting in their mouths. Further, as a nation, we should understand what every other major country does. Healthcare is a human right, not a privilege. The function of a rational healthcare system is to provide healthcare to all in a cost-effective way, not to allow private insurance companies and private drug companies to make obscene levels of profit. How does it happen that in the United States, we pay by far, not even close, the highest prices in the world for prescription drugs? How does that happen? Why is it, people are asking, that nearly 1 out of every 4 Americans cannot afford the prescriptions that their doctors write? Think about how crazy that is. Well, the truth is that the answer to that question, in my view, is not complicated. And in fact, it can be summed up in just 3 words, and that is unacceptable corporate greed. Unacceptable corporate greed. Alexander Fleming developed penicillin, a huge advance for medicine, saved, millions of lives? Frederick Banting sold his intellectual property for $1 for insulin. All right. What do you think about those guys and those scientists who said, you know what, our function in life is to create wonderful drugs that will ease human suffering and save lives, not to become excessively rich. The only thing that motivates you is to become a billionaire.
That's not true.
All right. But then can we have a science where people get paid well? I have no problem with Moderna making money. But you're hearing here massive cash paybacks, you becoming a multi-billionaire. Should we develop a counterculture, perhaps, which says your motive is not just making billions, but developing all of the drugs we need for the terrible diseases that this world faces? Year after year, decade after decade, we're talking about the outrageous cost of prescription drugs in this country, the huge profits of the drug companies. President has proposed, and I agree, that Medicare must negotiate prescription drug prices with the pharmaceutical industry. which is exactly what the Veterans Administration has done for 30 years. If Medicare does that, we lower the cost of prescription drugs by 50%. Not bad.